I'll introduce you to them in just a second. First of all, I want to tell you about a Granite Communications sponsored event that is coming up next month, focusing on the opioid crisis in 2019, a community response. We're going to hold it at the City Station here in Carrollton. It'll be Wednesday, April the 24th, 11:30 until 1 o'clock in the afternoon. We'll have a intelligent panel there to share information locally, and we do hope you attend. We'll talk more about it in the next month as we get closer to that. But until then, I brought in a couple of gentlemen from the Carrollton Police Department Gangs and Narcotics Unit. Sitting to my left is Brandon Paderas, and sitting to my right is the ping pong champion of the city of Tallapoosa, Chad Taylor. And appreciate both of you guys coming out to talk about it. We've talked with both of you a couple of times this year about opioids and how they're affecting Carroll County and affecting Carrollton, because it's a national story. It seems like on the news we're hearing about it every day, how big of a problem it is. The state that I grew up in, West Virginia, I think the city of Huntington is probably, they're calling it the worst place for opioids in the nation. How serious is it here in Carrollton?
It's pretty bad. It's bad everywhere right now, without a doubt. In Carrollton, we're just obviously aware of it because that's what we have to work. I think that it's growing. It's a growing problem, even though that the state's trying to combat it as best they can. You know, recently they created some laws and put some things into effect to actually bring the scheduling down for oxycodone and hydrocodone, which made it a little bit harder for people to get fake prescriptions and call in prescriptions and things. Now you actually have to bring a written prescription or an e-prescription in to actually get that stuff. So they're doing what they can, but it's here. And I think the biggest thing is it already kind of set foot in our community and in our state, to the point that even now they're kind of having to backtrack and doing what they can to combat it. But it's already set itself a precedence. So we're kind of playing cleanup now with people that are already strung out on it, using it, trying to find it. And because of that, we believe some of these other drugs like heroin and fentanyl have really made a push back into our country or even in our community, because people already want this stuff. You know, they've known about it and they've been using these pills and opioids for so long that now they're seeking other methods to get that same high.
So when I started this job about 10 years ago, I remember we were doing a lot of meth stories, and there was a big issue, talking a lot about that. Then we went through the synthetic marijuanas and the bath salts, and opioids seem to be the big issue. But it's not like any of those other ones went away either, right? We're still dealing with all of these drugs just as much as we were to begin with.
Yeah, I don't think bath salts near much. I mean, we did a really good job of cracking down on bath salts with new laws and just making this stuff illegal, and it kind of fizzled out. We haven't seen that in quite some time, wouldn't you say? A couple of years for bath salts.
We haven't worked a case on that in a while. And
Yeah.
I think a lot of the city ordinances and things like that help too, with not being able to sell things in stores.
Let's not be scared of that mic, Jay.
Well, you're supposed to take care of this now. There's a lot of ordinances that we're not selling things in stores and different things like that help combat a lot of this stuff.
Yeah, it's just the times are changing, we think. This is the current trend that's making its way, just like fentanyl. I think working drugs for quite a long time, I've seen it just kind of the ups and downs and the roller coaster of what drugs become popular or prevalent in our area. We still combat all the others. We still have our big marijuana cases. Our methamphetamine is huge right now. Cocaine is still there. We see this stuff daily, but we know that the pill cases have just shot up. They really have. Specific with opioids, just about every dealer we encounter now that's a legit dealer on the street, whether it be for primarily marijuana or cocaine or meth, there's a high likelihood they're going to have some hydrocodone or some oxycodone or, Suboxone, strip, something like that, because they know they have clientele across the spectrum that want this stuff. I mean, it's always going to be there, and it's not specific to a demographic or an area. This is something that everybody wants.
You talk about the pills. Are they all? Do they all come from a doctor's office somewhere, or prescribed by a doctor, or is somebody making these elsewhere?
A little bit of both right now. I think the majority of what we're seeing in our community is going to be from doctors, and we're aware of that. We try to partner with who we can to make sure that these doctors are prescribing like they should be. They are controlled and monitored, but with our resources, we can only go so far with the doctor end. We try to look into it, look for specific doctors that might be in our area that are over-prescribing or allowing doctor shopping to occur, or some of these pain clinics. But just, our sister counties and up in Atlanta, people are actually making these pills, counterfeit pills left and right. And that's where we're starting to see a lot of these fentanyl cases. We've got an officer attached to HIDA with the DEA, and they work pill press cases and things like that quite a bit. And a lot of these counterfeit pills, and they're actually seeing the big fentanyl cases where they're mixing this stuff into counterfeit pills, try to get the same effect.
And you talk about the fentanyl. How is that made, and where is that? I mean, I don't want you to tell us how you make it, but where does that come from?
I think the majority of it's coming in from China or overseas. At least that's what we've been instructed. It's definitely coming in vast quantities, and once it makes it here, it gets distributed out. It's extremely potent stuff. It's dangerous stuff, and it's meant to be cut in with other drugs. Not specifically your meth or your cocaine, but obviously with these pills, when they're making the counterfeit hydrocodone, oxycodone, or just a fentanyl pill itself for people that want it, they're having to cut it with a lot of substance and binder because it is unbelievably strong. The most recent numbers I saw was about 5 grains of high-quality fentanyl is enough to be fatal. I mean, 5 granules, just maybe pieces of salt. So that stuff's really got to be cut down with the different types of dope so that folks can actually consume it. But as we all know, these guys aren't always the most bright when they're making this stuff or creating it. So that's where we start getting our overdoses because of that. People don't know how much is in it.
And fentanyl, it's a synthetic drug.
It is, yes, sir.
Just like with the marijuana or the bath salts was previously.
Yes, sir.
Are there laws on the books right now against fentanyl, or is that? I mean, are they changed every? Does fentanyl change every year? Because I know as soon as you put a law on the books, all that they do is like change one little way that they make that, and it's not against the law anymore.
Oh, it's definitely against the law. All this stuff. I mean, really, anything that's going to change the way you feel on that end is normally going to be scheduled. And just about every controlled substance we have in the books, minus marijuana, is a felony charge. So it's there. Fentanyl is definitely up there. I believe it's it's considered one of the more dangerous things, obviously, right now. But it does have medical use. So your Schedule I controlled substances like meth or heroin do not have a medical use. But you get into some of these other things like fentanyl, and it's actually used in the hospitals, and it's used for people's pain and cancer patients and people that actually need it. And unfortunately, it's getting abused so bad that, I mean, folks are finding obscene ways of getting this stuff. We've heard of people stealing fentanyl from trash cans, from the patches and things like that, from elderly at nursing homes, stealing them from people who actually have it from cancer patients and the works. So even before it was brought in from China and actually in raw quantities, it was actually being used here, and we saw people chewing patches and cutting patches up in the works trying to get this stuff out of it. So
well, I've heard enough from doctors in the news and from you guys to know how serious and how scary it is. You talk about 5 grains of this. What are they telling you when you talk to these people who are using that? I mean, why are they not scared about how potent this is? I mean, because we do hear of a lot of overdoses and death.
I don't know that it's always their, on a user level, I don't know it's always their intent to intake fentanyl. A lot of times it's cut. And like you said, you're using it synthetically to make if you're selling a product, you want to sell the best product possible. So the people making the pressed pills, things like that, the counterfeit pills, they're putting fentanyl in it to get a higher result. So from a user level, I don't know that they're always reaching out to get fentanyl as much as they're reaching out to get this end result from Suboxone strips or oxycodone in that kind of format. So I really don't think they're reaching out specifically for fentanyl. It's just a product that's being pushed out there.
There is a medication which can, I guess, bring back, maybe shock your heart. Oh no, actually it blocks the opioid use. It's called Narcan. We'll talk about that and how you guys use that and how much you have used it here locally when we come back from our first break. Sitting down with Brandon Paderos and Chad Taylor, both with the Carrollton Police Department Gangs and Narcotics Unit. And I want to remind you that Granite Communications is sponsoring an event in April, the Opioid Crisis 2019, a community response. It'll be at City Station, Wednesday, April 24th, 11:30 a.m. until 1 o'clock p.m., and I'm sure we'll talk lots more about that as that event approaches. We'll take our first break now. Community Voice brought to you by Tanner Health System here on News Talk 1330, FM 106.3.
At Tanner, we're advancing health throughout West Georgia and East Alabama because we know that exceptional care isn't based on how many patients we serve, but how well we serve them. That's why we're focused on quality, delivering the best possible care for our patients. It's why we're expanding our clinical services and building new facilities to serve our growing community. And it's why we're looking beyond our hospitals and medical practices to develop sustainable wellness and preventive health programs in our region. What makes a hospital great has changed. It's not how many beds we have. It's how well we care for the neighbors who need them. Delivering the right care to every patient, every time, is how Tanner is advancing health with medicine beyond measure. Learn more at tanner.org or find a physician on our medical staff by calling 770-214-CARE.
Well, good morning, everybody. Welcome back to the WLBB Community Voice program. Our show brought to you by Tanner Health System, News Talk 1330, FM 106.3. Also this morning, streaming live on the News Talk 1330 WLBB Facebook page. So good morning to you turning in. It's now 8:42. My guests this morning, Brandon Paderas and Chad Taylor. They're both with the Carroll County ACE unit. And we're talking about the drug issues here in Carroll County and in particular in the city of Carrollton. Before we went to the break, talked about Narcan. Talk about what that is and how that is used to treat opioids and overdose.
Yeah, naloxone's a great thing that we have right now called Narcan. But it was brought up here recently because of the opioid epidemic, and people were overdosing so much that when naloxone finally came out available to first responders, it's a self-sustained little device basically that contains about 2 doses in it. One for each nostril. They actually squirt it into a nostril. It affects your brain and actually blocks the receptors and actually brings you back from that high. One of the more dangerous things of opioid abuse is that it's going to inhibit your respiratory functions. So it's going to be hard to breathe. People are going to start having issues. They're going to be falling out, unable to maintain consciousness. So our first responders are able, fire, paramedic, even police officers. Every single one of our police officers carry it in their car. And have had to use it already on numerous occasions. But if they find somebody they suspect to be overdosing or struggling, and they believe that they're actually using an opioid like this or hydrocodone, oxycodone, fentanyl, something similar, they'll administer a dose of this Narcan in their nostrils, and within seconds to minutes, this stuff can start having an effect and will bring them back. Now, by bringing them back, I mean bringing them back from their high, wherever, whatever planet they may have been on at the time. But also, it actually kind of brings them right to at the bottom level of if they were actually going through some DTs. So they don't always come out very happy. They've lost that good feeling they've had. Maybe immediately come back with headaches or anger or the things that somebody like an addict would have after quite some time not having their product. So that's a danger we have to face, but it saves their lives. Some people have to have multiple doses to actually counteract the drugs, which is absolutely frightening right now. We've heard, I recently spoke with the fire department on a medical update and was just reaching out to them to give us information about their Narcan use. And they said they've had to administer multiple doses on individuals in the recent past, to try to get people to come back, keep them from dying and overdosing. So the stronger this stuff gets, the more people are using and the bigger their tolerance, the more Narcan we have to administer to get them back to that normal level.
But it could save an officer's life too, as well.
Absolutely.
That Narcan, because you talk about the grains. It's airbound, and what was the good word you used?
Insufflation.
Insufflation. Yeah, the possibility of it just floating up your nose, right?
That's right.
But no police officers have had to use it for themselves here.
Not that I know of.
I'm not aware, and they keep record of every time that they've used Narcan, and we haven't had any officer exposures that I know of. I believe we talked about. I think there was an exposure with fire, but we have different gloves now and things like that help kind of counteract that.
What is the officer's responsibility? I guess, first of all, how do you find out when there has been an overdose? I'm assuming a friend or somebody calls and then they kind of leave the scene and just leave that person there, because there would be the concern that, we've done this for using illegal drugs, so are we going to get in trouble?
There's actually laws in place now to help that.
Mm-hmm.
So if you come in and you bring someone to the hospital or things like that, you've got a little bit of, I wouldn't say complete immunity, But if you've done the right thing, there's laws to protect that person. But a lot of it is a lot of it's family members. Officers will find people that are in this stupor, that are passed out, because it is suppressing breathing. You're going to lose consciousness when you overdose. And most of our unattended deaths or in overdoses are family members. That has been, it's the person who's the caregiver, the one who comes and checks on them all the time, because a lot of times it's the family members keeping them from overdosing in the past. We've seen that with opioid abuse.
Do officers have a responsibility, or what can you do as far as you want to help them, you want them to get off the drugs? I mean, do you guys have a responsibility, or does somebody else, point them in the right direction to try to help them so they're not doing it again? Because, I guess they almost feel like they cheated death, so maybe they're like, yeah, well, I'm not worried about it now.
We've got some great programs. I mean, our philosophy working drugs is that we try to help the users and put away the dealers. We don't do a whole lot to affect our community by arresting every single user we find. It just doesn't do a whole lot. That's one person who's made bad decisions. So our goal is to follow that ladder up as high as we can and find out who's distributing this stuff out to folks. So when it comes to users a lot, there's some great resources available. We do try to help them as much as we can. There's programs like drug court right now. That's an alternate to just specific charges. So if people meet the qualifications and the specifics, we have a board comprised of members from the Carrollton Police Department, judges, our DA's office, and they actually examine individuals who may have been charged with certain types of drugs, and then they'll look at those individuals and see, okay, you fit our categories of somebody that might be good for us to put in this program, allow them to get clean, maintain urinalysis, whether it be classes, rehabilitation type things, and as long as they maintain this probation period where they do right and they get themselves clean, then their charges actually are either reduced or dismissed. They're up to some high standards now. They have to do what's right, and if they fail to meet those standards in drug court, then it's right back to to the original charges or possible sentencing that was thought of. So
I do think that's one of the strengths of Carroll County, just like the opioid board that's coming up, the panel. We educate the public, and then the powers to be, they put things in place to assist with drug court. We have mental health court.
Yep.
We educate our doctors. We now have programs, immediate programs in place like Willowbrook, where a doctor can 1013 someone which is basically remove their rights. They're in the custody of the state at that point, and put them in a facility for 72 hours to maybe help move that process for either rehabilitation, detox. But a lot of that comes from community education. Mm-hmm. It really does. I think our community plugs in really quick to a problem.
We talk about withdrawal symptoms, I guess, which is encouraging somebody to go back on there even after you've revived them.
Yes.
How long is that period? I mean, is it like between 72 hours and 5 days? Is it?
I think it's dependent on how extensive somebody's use is. Yeah. I mean, if somebody's been on this stuff for years, or if they've maintained a steady dose of this stuff, I mean, it might be a little bit longer. It could be days, and it can be very dangerous days. The body, and once it kind of reaches a homeostasis of control over this stuff, you change something of it, that magnitude. I mean, the body's going to have to fight for it. It's adjusted, it's made changes. So I can't give you an exact number of how many days or hours it takes to pass through the withdrawal symptoms, but from what I've heard and spoke with, other users, I mean, it's pretty awful. I mean, this stuff is nasty. It's no different. I mean, basically, these prescription pills and opioids is just synthetic heroin. So if you look back, when the heroin epidemic was at its peak, and all the people that would actually go through these DTs and withdrawals this bad, I mean, it's very similar. It's actually the same thing. It just, of course, heroin scared us. It was intravenous. It was bad stuff. Pills, they might be a little bit less potent at times, but obviously now with fentanyl, it's coming back. So I think the withdrawal symptoms are similar, if not the same, and Narcan's, we'll bring them there in a hurry. So,
one last thing on Narcan before we take our second break: is there any concern that that people who do overdose and they're rescued with Narcan, that they kind of just take that for granted and almost aren't worried about it because they feel like Narcan will pull them out of it?
It's always a worry. We wish we knew what they were thinking sometimes. Obviously, it's publicized that we have it, we keep it. There's grants out there and places that folks can go to get this stuff. I've heard.
So anybody can get it. Anybody who.
Yeah, I think it's available, and there's programs, and people are trying to distribute this stuff out as much as they can for folks. So,
and the big thing is, I don't think our officers can. I mean, in the way we administer Narcan and things like that, it's not going to change on the end user. Our job at that point is to fix that immediate need, that immediate medical need. They're gonna administer Narcan, and if they have to do it again 3 days later, our guys they'll do it again 3 days later, and we'll just keep fighting and find programs like we talked about to maybe sway them in the other direction. But so that with Narcan as readily as available as it is, our guys they'll just keep fighting that fight, and they'll administer it as needed. They're not gonna not because they're guessing, well, maybe this guy's abusing it. They're just going to do their job and hope we can find help on the backside.
Chad Taylor and Brandon Paderas, our guests on this morning's Community Voice program. They're both part of the Carroll County ACE unit, also in particular Carrollton Police Department's Gangs and Narcotics Unit. We're talking about the opioid crisis here in Carroll County, or the issue with opioids here in Carroll County in the city of Carrollton. And I do want to remind you that Grady Communications is sponsoring a seminar in the next month. It's called the Opioid Crisis 2019, a community response. It's going to be at the city station in Carrollton from 11:30 a.m. until 1 o'clock. I believe a lunch will be provided. It's Wednesday, April 24th, and we'll have more information on that event as we get closer to it. So stay tuned to these Grady Communications radio stations. Right now it is 8:52. We'll come back with about 7 minutes left in this morning's program. Community Voice, brought to you by Tanner Health System, News Talk 1330, FM 106.3.
At Tanner, we're advancing health throughout West Georgia and East Alabama because we know that exceptional care isn't based on how many patients we serve, but how well we serve them. That's why we're focused on quality, delivering the best possible care for our patients. It's why we're expanding our clinical services and building new facilities to serve our growing community. And it's why we're looking beyond our hospitals and medical practices to develop sustainable wellness and preventive health programs in our region. What makes a hospital great has changed. It's not how many beds we have. It's how well we care for the neighbors who need them. Delivering the right care to every patient, every time, is how Tanner is advancing health with medicine beyond measure. Learn more at tanner.org or find a physician on our medical staff by calling 770-214-CARE.
It's now 8:54. Welcome back to the WLBB Community Voice program, News Talk 1330, FM 106.3. Also this morning streaming live on the News Talk 1330 Facebook page. My guests, Chad Taylor, Brandon Paderas with the Carroll County ACE unit, talking about opioid issue and other drugs that are prevalent here in Carrollton and Carroll County. I want to remind you of an event coming up next month, the Opioid Crisis 2019, a community response. It'll be held at City Station, 11:30 a.m. till 1 o'clock, Wednesday, April 24th. And if you stay tuned to these Grady Communications radio stations, we'll have more information on that as we do get closer. Our conversation today has been focused primarily on opioids and how much you guys come in contact with that issue here locally as Carrollton police officers. Share some numbers with us, I guess, over the last few years that you can kind of give us an idea of how many cases you're working, how many overdoses you've responded. And I guess in your numbers for overdoses, is it just Carrollton Police and not the fire department?
Yeah, so the overdoses actually are, for the most part, we had to lean on the fire department, EMS. 911 calls actually helped us with that more than anything, since obviously they see a little bit more, and we don't always get called out to every medical call. But our numbers right now, I mean, they're pretty staggering, and I only pulled a couple of years worth of statistics as best I could. But we had 25 overdoses in 2017. And that number shot up to 37 overdoses in 2018. So that's about a 48% increase in actual overdose cases that either law enforcement or medical personnel have responded to. However, our overdose deaths have actually reduced in those 2 years, from 5 in 2017 to 1 in 2018. We can't say for sure whether or not Narcan was responsible for saving some of those deaths and actually keeping that number from being higher, but we do feel confident that it's a possibility, that we were actually able to, give and administer that dose, hopefully a life-saving dose to people that keep that number down. So it's about an 80% decrease when you kind of combine the two and compare them. As for specifics to what we know outside of patrol through the ACE unit, ourselves in Carroll County, University of West Georgia, on our joint task force, we have increased our seizures quite a bit. In 2017, we seized about $10,000 worth of prescription pills in cases that we worked, just us, on our own specific self-generated cases. And in 2018, that number jumped up to 51,000. So we saw a huge influx last year and people actually getting this stuff specifically in large quantities, cases where we're dealing with 60 plus oxycodone 10 milligram pills or even more. So you're getting into some high dollar stuff when you do that, $10, $30 a pill type stuff. So the numbers are up, without a doubt. I tried to compile as much as I could from patrol. These guys work hard. Our patrol officers do, Carroll County and in the city, and they're making cases nightly, daily, and their numbers would show probably double what we have in terms of how much they're seeing on traffic stops, whether it be responses to shopliftings or overdose cases, et cetera. So they're seeing stuff, they're trying to get it back to us, and then once we get it, we try to run with it and find out who's actually putting this stuff out there.
Mm-hmm. When you see like $50,000 worth of pills that you're collecting, can you put a number on how many people that could have affected? How many, and do you think that all stays here locally? All those drugs would have stayed here locally?
Without a doubt, yeah. Once we kind of get our hands on it in a case, we have identified a distributor, for those numbers. So that's definitely affecting our community without a doubt, and it spreads out, like a plague. It just does. For numbers of people that it might be affecting, I mean, you're talking about, maybe a 10% of the city there. You're talking about college kids, that a lot of the stuff is seized from or nearby. You're talking about our youth in schools who think, prescription pills maybe not be as dangerous as some of the other drugs that are out there. You're talking about our addicts that are seeking this stuff out, that have had issues or prescriptions in the past. So it's not just bad folks that are using this stuff or finding it. These are either, our youth that are looking for, a way out or an excuse to get high, or you're talking about good people that have had legit injuries or problems and were prescribed this stuff for a long time, and all of a sudden they can't get it anymore, so they're looking for it on the street.
Got about 2 minutes left in the program. What kind of advice can you guys give to a family member who's convinced another family member, mom, dad, even brother, sister, might have a problem?
They've got to seek help really quick, and don't give up that battle. It is a constant battle in addiction. We've seen it. There are programs in place. There's lots of help through Tanner, through the police department. Worst case scenario, call us. I mean, we'll come, we'll help. We're more than just showing up and locking people up.
That's right.
Unfortunately, that's how we're perceived a lot, but we're here to help fight this battle and fight this crisis. So there is help out there. So don't try to do this on your own. That's where people kind of get behind trying to fight and pull this family member out. There are resources in place through us and the community. So don't fight it alone.
And I would encourage people also, if you might have a family member who's dealing with this, to attend this opioid crisis seminar, community response. Again, it'll be at City Station on April 24th. That's a Wednesday, 11:30 a.m. till 1 o'clock in the afternoon, and we'll have more information on our radio stations in the coming weeks. Gentlemen, thanks for coming out. Appreciate
Thank
it.
you.
Very
Appreciate
important
you
and informative conversation. And good to know you. And again, thanks for listening to this morning's Community Voice program here on News Talk 1330 FM 106.3. If you missed any of the show, I encourage you to visit our website, newstalk1330.com. We'll have the complete podcast up there shortly. Have a good weekend, everybody.